Hello and good afternoon, everyone. I'm thrilled to co-host this session again with the amazing Caitlin Anderson. Hi, Caitlin.
Hi, Monica. How are you?
I'm great, thank you. Um, Caitlin is our esteemed senior clinical specialist. And today, following the success of our previous webinar on unlocking the secrets of reversing photo aging, Caitlin and I are really excited to guide you through a comprehensive exploration of our elite facial treatment, offering an in-depth understanding of the entire process and the transformative experience it promises. Before we dive in, I'd like to take a moment to introduce SharpLight Technologies for those of you who may be a little less familiar with who we are. Established in 2004 and headquartered in Israel, SharpLight Technologies has been at the forefront of innovation for non-invasive and light-based technologies for various aesthetic treatments. As a private company and a subsidiary of the largest chain of aesthetic centers in Israel, American Laser Clinics, with an impressive network of 13 locations and over 500 employees, SharpLight Technologies is deeply rooted in expertise and experience. What sets us apart is our global presence, reaching over 60 countries worldwide. We are dedicated to providing solutions that not only meet but exceed the expectations of our partners, enhancing their business performance through cutting-edge metastatic technology. Now, without further ado, let's take a look at what to expect in today's webinar. We will delve into the intricacies of our elite facial and explore how it serves as a powerful tool in reversing photo aging. We will look at client assessment and how to perform the treatment. We will also show you the incredible results of a stacked treatment, such as the elite facial, and what those results are after just one session. And we'll finish off today with a recap of the revenue potential when offering combination treatments at your clinic. So with all that being said, let's get started. We do have our Q&A box enabled. So if you have any questions along the way, please feel free to throw them in the chat and we will answer them as we go on. So what is the elite facial? The elite facial is an advanced treatment where we combine several technologies, our Q-switch, our DPC technology, as well as our Nd:YAG, by stacking these handpieces in one session to target signs of photo aging. We start off with our CC peel, and that's going to remove all the dead skin cells, all the debris, anything sort of sitting inside those pores, any excess oil, preparing it for an even better treatment where we've now sort of cleaned that dirty window, we've removed that surface, and we can go in with our VP Dual, which is our spot treatment, where we can target those pigmented and vascular lesions. And then we can continue on with our SR580 handpiece. This is our skin rejuvenation handpiece. We can focus on fine lines, wrinkles, that collagen rebuilding. We can also work on pigmentation with this handpiece further if we have a lot more of that, if in our signs of photo aging. And then finishing off with our Nd:YAG, that fractional handpiece where we resurface the skin. So we can help even the skin tone and help build that collagen even further, where we see that collagen loss in that photo aging skin. So the indications itself for this treatment is photo damaged skin. We can treat the face, the neck, the décolleté or chest, and the hands. We do get photo aging on the hands as well. You know, when you're driving your car, a lot of us forget sunscreen on the back of our hands. We can do 4 to 6 treatments in a session. That's usually what we recommend. But you will see results after one treatment. Usually about 7 to 14 days post-treatment is where you see the best results after the skin has sort of gone through a bit of a peeling phase and a healing phase. And we can do these treatments every 4 to 6 weeks. We will continue to see results up to 9 months because collagen continues to build post-treatment. So you're going to see incredible results. You're going to see that reversing that photo aging over the months to come as well. So I'm going to pass the mic over to Caitlin. She's going to take you through the consultation with our model, and then we're going to go right into the treatment itself. You're going to see the step-by-step process, and we're going to give you some technical insights and clinical insights as well. So make sure if you have any questions along the way, pop them in that chat box. All right, Caitlin, go ahead.
Thank you, Monica. Okay, so I'm going to go ahead and introduce our model, who is Sonia. So Sonia is a 45-year-old female. When we were chatting with her about her skin concerns, the primary was saying that she, struggles with pigmentation and crow's feet, general photoaging concerns. We also talked about her broken capillaries on the apples of her cheeks and her chin, and her general aging concerns. Her lifestyle, she has 2 children, and she says she eats relatively healthy, although she drinks a lot of coffee and definitely not enough water. And she says that she doesn't sleep very well. So she does feel like her skin looks a little tired and dull, but generally good overall health. Her photo aging journey, she has done some photofacials prior to this treatment. She does use SPF on a regular basis, which is amazing. We need to use our SPF to protect our skin from the sun to prevent further photoaging issues. And then she has a good skincare routine in general, very simple, however it works for her. But no contraindications for this particular treatment. So that is our model for today. Our next thing that we did do, I'm just going to switch the screen here. So we did some photo before and afters with this particular candidate. Of course, it's really important to do your before photos before starting any series. This is going to give you a starting point. The best time to take this photo is right after a really good cleanse of the skin, making sure all the makeup's removed, and making sure she's prepped for the treatment. Now, we are going to do a deep dive into how to do your before and afters in our next webinar. So please make sure you stay tuned for that. We do provide you with a list of things you need to have in order to have a proper before and after photo. And but we will jump into that in the next weeks to come. But just understand that they're really important. It's really important to make sure that you have a nice clean photo, as well as not only for their journey as the skin improves, but making note of things that are already on their skin, whether it's treatable or it isn't. It's a really good place of reference to start from. So that's for before and afters. So I now have the video for you. We did film the treatment in action, so I'm going to go ahead and open that link. Oh, sorry, Monica.
All right, I'll open the link here.
Thank you. I appreciate that. Okay, so we'll go ahead and, as I said, we're going to prepare the skin. So first, we're going to do some cleansing. So you'll be able to, there we go. You'll be able to see me cleanse the skin, getting the skin prepped for treatment. Now, this is obviously an important step. In this particular moment, I'm actually analyzing her skin. So we did talk again about her major concerns, which was the pigmentation on her skin, as well as the vessels, the fine lines and wrinkles. And so this is what I'm doing. I'm actually seeing and preparing where I'm going to be treating those vessels. I'm also noting anything on her skin that shouldn't be treated. She has a mole on her neck, so I'm going to make sure that I avoid that particular spot. I'm checking if she's got any other issues that she wants to address for the treatment, and making a mental note of those. So now we would do the before photo. So I've cleansed her skin, I've analyzed, and now I'm going to take a photo of it to capture her at the beginning of her journey. So that's where we stood up and we did the proper photo. Now I'm adding the metal goggles. Metal goggles are for laser. It's really important that you use the correct goggles when you're doing these treatments. And we're going to get right into the facial. So the facial starts with the Q switch, the carbon correcting peel. So applying the carbon is a little bit of an art. You want to make sure that the area is it's thin, but has good coverage, nice even coverage. So you can see me doing that, making sure that the entire area is covered and it's even. I usually apply it with a glove. You can use a silicone spatula. It doesn't matter. Right here, I'm actually using a Q-tip to clear her areas of where I don't want the carbon. Anywhere the carbon is, it's going to lift the pigment. So around her eyebrows, where she has hair, her hairline, even around her vermilion border, areas where we really shouldn't be targeting. I usually use a Q-tip just to clean up my edges. So that's what I'm doing here. Now I'm going in with the carbon treatment. So this is using the Q-switch Nd:YAG, and what it's doing is it's lifting the debris from the skin. So as we know, carbon is a sponge for soaking up dead skin cells and oil and dirt and debris from the pores. And so this is really exfoliating her skin. You want to make sure that tip is nice and perpendicular to her skin without necessarily touching the skin, following the contours of her face. The farther you are away from the skin, the more she's going to feel it. This doesn't hurt really at all. It feels like almost like a feather tickling your skin. And really it's pulling that carbon. What's important to note here is I am using the 6mm to lift the carbon. I'm using a jewel that's consistent with pulling the carbon from her skin and my endpoints. I'm doing a 30% overlap. You can't always get every spot of carbon. As good as I am, it's not always easy. So just getting the majority of the carbon off the skin is your goal. So that's what that 30% overlap is for. Anything that's remaining, I will clean off in the end. If you're finding that you can't do those big, long, stretches on the skin, that's totally fine. You can always do a stamping on the skin, essentially. And that's generally what I do around the nose and things to make sure that I'm treating her skin and not treating where I shouldn't be treating. So we're just finishing up the forehead. And then here is, I'm actually cleaning off the skin. So our next step is with the DPC. So we need that carbon to be completely off the skin. And that's what I'm doing here. So this is the after of the carbon. So people can have this treatment and it can end here. It's going to give you a nice, beautiful glow. It's going to stimulate circulation. So you can have this nice, smooth, lively looking skin post-treatment.
Kate.
Yes.
First of all, her skin looks amazing even after just the first step.
Of course.
But this treatment definitely takes a steady hand. And when we train on the carbon correcting peel, it's all about taking that time. Don't start off on your highest hertz first. It's not a race. To get to where Kate is and how good she is and how smooth her application is, you start out slow, right? Start out and work your way up and really just work on that with that steady hand, because like you said, it's always impossible to get all of it, but you do want to try to lift it all. And that's why you were going so close, right? And getting that really great application. So is that, tell a little bit about recommending where to start, practicing to get to as good as you are. Obviously that comes with a lot of experience, but
right.
Yeah.
Generally what I'm doing, carbon, I'll work kind of in clockwork motion. I'll start on the forehead or I'll start on the cheek and kind of work my way around. Remember, the client's eyes are closed, so they're not going to really know where you are at when you're working on the skin. So it's kind of nice to let them know where you're going, and working in a fashion, clockwork around the skin, so they're not surprised where you're at and not jumping all over the place. So but yeah, you start slow. Again, you don't have to use a fast hertz like Monica was saying. You can start slow. This treatment doesn't hurt at all. It's actually quite relaxing, so that works just as well, going nice and slow.
And that was going to be my next thing. A lot of people ask, do they feel this treatment with that photoacoustic? You hear it, but you don't feel it because we're working just on the surface.
Exactly. It's just superficial, lifting the dead skin layer. It's really cleaning the skin, shining getting the debris off the skin, and so that laser can shine right through. What Monica said earlier, you can't shine light through a dirty window, so it works out perfectly.
We do have one question in the Q&A for you, Kate. Is this
Absolutely.
safe for skin type 5 or 6?
That's a great question. So this particular treatment can be fine up to a skin type 5. Right now, we don't have the protocol for a skin type 6, so it's used on skin types 1 through 5 only.
Perfect.
Okay. All right, let's continue. All right, so step number 2 is the VP dual spot treatment. I always do my spot treatment first before doing the SR. So we're going to change the goggles for your DPC goggles. And I'm going to go ahead and use a white eyeliner pencil to mark my lines. This will allow me to follow a proper pattern with my treatment. This is a specific pattern that SharpLight does that we train in our in our treatments. And so I'm going to now go and do some isolating. So this is what I'm doing. I'm actually drawing boxes around where she has those blood vessels, where I'm going to use my VP dual. So this kind of marking will work for both the VP dual part and the skin rejuvenation. VP dual is amazing for clearing broken capillaries and spots. And you can go on the area a couple times. So depending on where you're treating, you can do the spot 2 to 3 times, always looking for those clinical endpoints, the vessels disappearing, the pigmentation darkening. That's what you're really looking for when you're doing the VP dual. So that's what I'm doing here. And you can see she's jumping a little bit, and that's totally normal. It's a bit of a snap on the skin, especially if we're hitting those vessels properly. And what I'm showing you here is actually she's got some bruising. I'm just going to pause it where you can see it. And when we're using the VP dual, because we're treating broken capillaries and because it's such an intense shot of light, you're going to notice that there could be some bruising. There could be some inflammation, edema, sometimes even swelling like a bee sting. And this is totally normal because of the effects of the thermal energy in the skin at such a high intensity. So if you do see this happening during your treatment, you can take a deep breath and realize that it's just normal. And what I'm doing now is I'm actually cooling her skin. Sonia was saying that she had some extra heat in the skin. And the one thing that I always say is if there's heat in the skin, we want to add cooling right away. By doing that, it actually will help to pull the heat out of the skin. Thermal relaxation time is all about maintaining that heat, and we want that heat for correcting, but at the same time, if it's too much, we can leave pigmentation and burns on the skin. So by cooling, when a client is saying that they're uncomfortable, this is your best preventative measure. You can use cool packs. You can use a cold cloth. I typically just use the tip of my laser because it has a -8 Peltier crystal on it, which is going to help cool the skin perfectly. So I'm going to go ahead and show you that. So I'm still cooling her until she says, I'm okay to continue. So now we're jumping into the skin rejuvenation. This is the 580. So this is our moment where we're going to talk about doing the treatment to help stimulate collagen. It's going to help stimulate elastin for texture, but it also can help her with her pigmentation, which is one of her primary concerns. So I'm going to go ahead and use skin rejuvenation on her skin on the pigmentation setting. So I'll show you this now. Always full contact. You can see me squeezing the skin here. Full contact is really important. I'm going to avoid those VP dual spots because as you can see, they're pretty red. So I don't want to continue treating over that. So I'm going to avoid those spots and go around. I do have a method of going around her skin in a manner. You can see me using a blocker here. So this is again for full coverage. Sometimes the crystal doesn't always fit on the nose properly, so I will use a blocker to prevent light going where I shouldn't have it go. And so that's me working on that. I'm using it on her neck as well. Yep. There we go. So again, this is addressing her pigmentation, her issues with a texture in the same amount. Now, Sonia has a little more of a sensitive skin type. I did only do one pass. You can do up to 2 passes with this. You can do a texture and a pigmentation pass. You can just do a texture or just a pigmentation. Really depends on the client's concerns. Because Sonia's concerns were pigmentation, I did a pigmentation pass for her. She was feeling kind of warm after, and because I knew I still had one more step that I really wanted to get to, I opted to just do one skin rejuvenation pass, and that's what we did here. So I'm removing her goggles now, and we're going to go ahead and gently wipe off those white lines for our next step. So this is me doing that. You can use a witch hazel saturated in gauze to do that.
Perfect. Before you move on, Kate, we do have a couple of questions.
Okay, great.
One of my favorite treatments in the world is the skin rejuvenation. I had it done recently as well. Always super glowing, but love the fact that it builds collagen, especially because we lose so much, from 21 and onward. But I had a question that came after the CC peel, the carbon correcting peel. The attendee asked, is this safe for pregnant or expecting mothers? So this was for the CC peel.
That's a really great question. In general, any sort of laser treatments is not suitable for any women who are pregnant. There isn't any science behind treatments and doing them, and so we just use our best knowledge possible, and we just make sure that we aren't treating any pregnant women. That is an absolute contraindication. Thank you for the question.
And basically for all of them, I know it came after the CC peel, but for every
right.
step of this, so that they just wouldn't be a candidate for.
Unfortunately not. And usually we want to wait up to a year after pregnancy as well, because we want to avoid the breastfeeding and also any sort of hormonal changes that need to settle prior to doing any laser treatments.
Amazing. And then our other question here, just have to pull this up. What settings were used? And I believe that was brought in after the SR. The VP dual or the SR. So you can just kind of explain, what you were targeting there in terms of it, because everyone's going to be different in terms of parameters.
Absolutely. Yeah. As far as parameters are concerned, that's very subject to each client. So the VP dual, I did use the lighter setting for her broken capillaries. I find it works best on lighter lesions, and broken capillaries are definitely considered a light lesion. As well as the skin rejuvenation, I did the pigmentation setting for her because that was her primary concern, and I could really get using that particular setting. I could have done a texture pass afterwards, but like I said, because she was a little warm and uncomfortable pain-wise, I opted out of it, but I did use a pigmentation setting for that one.
Perfect. And Christina asked, can a client use retinol or different products with hydroquinone during this laser treatment?
That's a great question. Now, products are something that we have to consider. Different ranges and different percentages are going to cause more or less issues in combination therapy with the laser. Typically, things like retinols and hydroquinones are at a high percentage. We want to at least discontinue for a couple weeks prior to treatment. This is to protect the skin from being overstimulated. But if you just pause 2 weeks before and a week or two afterwards, that's totally fine.
Perfect. Yeah, retinol is a great thing for photoaging skin, but you
Yes.
don't want to be doing your retinol treatments right up to, and whether they're prescription, we wait 2 weeks, or if they're just an over-the-counter low percentage of retinol, about a week. But hydroquinone is something we want to talk about in an upcoming webinar when we get into melasma as well, because it's a great pre-treatment option. However, it needs to be used correctly and safely.
Yes, absolutely.
Amazing. That's it for questions on this section. So we can continue on with our last step of the elite facial.
Okay, fantastic. So we're going to move into the fractional skin resurfacing portion with the ND egg. Now we have a couple of matrices, sorry, that we can use. We have the 7x7 and the 9x9. The 9x9 is a smaller matrix. However, the spatial pattern is a little larger, whereas the 7x7 has more energy per dot. However, it has a smaller spatial pattern. So depending on what you're treating and what you're doing, typically for this facial, I'm going to use the 9x9 because I've already stimulated the skin quite a bit. So we're going to jump into that. So I am, again, switching the goggles for laser, and we're putting the metal goggles on. Now, with the erbium, I'm going to go over the area full face at least one time. My overlapping is about 20 to 30% to make sure I get everywhere that I need to go, the full face. Anywhere where you miss a gap, your client will notice because they'll see red and then they'll see these white lines in the middle. So you want to make sure you get that full coverage. Now, again, I'm just following my regular pattern, starting here and working my way around. And you can see, again, I'm just going to pause it here because this is actually, you can actually see the matrix, which is really cool. So you can see the matrix here where I've got all of those little white dots. Now that's the laser doing its job, creating small wound islets of tissue. The beauty of the fractional is that you can have a full resurfacing with peeling and everything, but it's much more controlled, and your downtime is minimal with the same effect as a full ablation laser. And in this society, downtime can be a bit of a pain. So having a downtime of 2 weeks versus a month, that's amazing to get the greatest results. I am also on the nose, you'll see I'm stamping. So again, when I'm working on the skin, if I can't get a fluid motion, I'm always stopping to stamp and make sure that I have a good coverage. And the other thing about this is I'm always going to make sure that I have, I'm sorry, I wanted to pause here too. I get so excited about this stuff. So what I'm here is I'm actually stretching the skin. So the one thing about the stamp and that you're putting on the skin is you want it as even as possible. So Sonia has some deeper folds in her neck. And so I'm really stretching the skin to be able to get inside the fold and make sure that stamp is nice and even, getting where I need it to go. So I'm just doing that. And I'm avoiding that little mole that's there. I'm not going to go over it at all. And so I'll pause here too, because with Sonia, again, we were dealing with somebody who has a little more of a reactive skin type. Because of her broken capillaries, she has a mild rosacea. I'm trying to be extra cautious in certain areas. And she was already feeling pretty warm, which is very normal with the fractional laser. You're going to feel warmth. It feels almost like a sunburn, kind of insidious in a way where you're feeling that heat sort of slowly building. And we want that heat is what we want. That's what's going to build the collagen and the elastin in the skin by heat stimulation. But what I do love about this is that you don't have to go over the whole area twice. You can fine tune your treatment. So what I'm doing here is I've gone over the face one time, and now I'm going back to her really concerned areas. She said crow's feet and her deep lines were really something that she really bothered her. So I am doing a second pass over her fine lines around her eyes in the neck area. So this is what I'm doing here. I didn't do a full 2 passes. I only did 1 and then spot treated. All right. And then that's it. We're going to do a cooling compress right after. I had those ready for her, and we cooled for about 10 minutes. And really, I was working and paying attention, always checking in with my client. How are you feeling? How's the heat? Give me a score out of 10. That way I know what she's feeling and I can address her concerns. Sonia had a lot of heat, so I cooled her. And then what we did is we actually added zinc cream afterwards. Zinc is amazing for cooling the skin, healing the skin right after a treatment like this. And it's also good for sun protection. So when she goes outside, she's protected for her drive home. I also gave her a pack to take home with her in the car, a cool pack, so that she could use it after. So we captured post-treatment photos, so that's what we're going to next. And we'll show you those.
Adriana asks, is a topical anesthetic required for the YAG fractional?
Wow, that's a really good question. So it's really up to the person performing the treatment. In my practice and things that I've been doing with the fractional, the pain isn't typically until after. So I don't really numb my clients or my patients prior to a fractional. I don't find that it helps them too much with the treatment itself, because the treatment doesn't really hurt. You're keeping the laser nice and perpendicular and close to the skin. It feels not even as bad as a skin rejuvenation would feel. The treatment hurts afterwards. That's where that sunburning effect comes in, and there's really nothing that's going to numb that. So you're going to want to pay attention to the cooling packs and using those instead. Now, so again, it's up to you. If you do end up using a numbing cream, make sure that it's fully removed. I would cleanse a few times prior to doing the treatment. Interactions with lasers and numbing creams can be a bit of an issue. So just make sure it's fully cleansed prior to using the laser.
Okay. For questions. So that's our elite facial. You guys got to see it in action. Caitlin, thank you for taking them through all the technical insights and clinical indications, what you're looking for. Something we stress a lot in our last webinar and into this deep dive is, watching that skin response, which you did. We can obviously do up to 2 passes of SR and up to 2 for the fractional. In a singular treatment, you can do more, but for a stacked treatment, we give you those parameters, and that's what we offer out, because we know what stacking is as adding in that thermal energy, causing thermal injury. So the client will feel a little bit more heat than just a single treatment session on its own. But I'm so excited to show you what's next, because we have some after photos. First, we wanted to show the post-treatment, and Kate will emphasize some of the things that she did within the treatment. And as you were talking about, over the next few hours, seeing that increase in heat. So some of the things that you did post-treatment with our client, you can see here, she does have some of that zinc, which is gonna, not be the best after photo. And that's why we kind of look at as our post-treatment photo. What does it look immediately after? And then we'll get into our after photos. But Kate, talk a little bit about this post-treatment journey with your client.
Okay, absolutely. So Sonia was amazing, by the way. One of the best clients. She was so good and patient, and did a really good job. I did, again, cool her skin. I did add the zinc afterwards. I sent her home with a cool pack. She really loved that. So I recommend that with your clients as well. And then you really want to follow up, especially if this is one of their first treatments with the stacked modality. This is more invasive than Sonia has ever really had before, so I wanted to check in with her. Sonia had some of the normal side effects: the swelling, the erythema, the darkening of her pigment. You can kind of already see it happening in her eyes here. You can see that brown pigment is now even darker. It's very red. The vessel that bruised is very dark. It's very, when she looks at the first, she's like, oh, wow, that's a lot of things that are happening on my skin. And they get a little nervous. But the phone call reassured her. I said, keep cool compresses, keep hydration, keep protecting. And within 24 to 48 hours, she was over the hump, and she was excited for the healing process to continue. So it was good. It was really good.
I think that's the difference maker, Kate, is that quick follow-up. It doesn't take much time, but especially, like you said, if someone's going into something a little more advanced than that they're used to. And Sonia was nervous, especially even that bruise, that you showed with the VP dual, that was normal. And we kept saying that in the treatment, reassuring the client or the patient as you were. But they go home, they see it, and maybe a little bit of swelling. But that phone call just helps really calm those nerves, reassure them to stick to the post-care. And when you're lucky and have an amazing client like this, and they comply, and they really take your call and your care as a part of their full experience. And something I've read recently actually is just, people will come back to you for the full client journey, not just your technical skills. Those are important, but it's the full journey altogether. So it's that client care post-treatment. And I think you made a big difference for Sonia, checking in with her, and you can even do a quick call on FaceTime if somebody's really nervous or
Mhm.
if they're worried about an adverse reaction. But everything was normal here. So I think it was a great way to showcase some of the things that can happen in a treatment, some of the clinical endpoints that are sort of side effects as well, like bruising, but that can happen when we're working on vessels, right? We can
Yes,
bruise. And just like a bruise, when bonk into the corner of a table, it's going to heal and it's going to go away. And the same thing happens with the face. It's really there, and people get really nervous about that. So
yeah,
offering proper post care, making sure to avoid heat, right? That's a big thing. I always say you don't have to cook tonight over
absolutely.
your stove. You get to sit back, put your feet up. Don't go in your hot tub or sauna, but really just helping cool, reduce that inflammation post treatment. So we don't have any questions. So this is going to be the wow factor here. Kate, I definitely want you to talk about this, but this just
Oh,
blows me away. One treatment, guys. This is massive. We obviously want to do a series with Sonia, but we were really excited to show you, our 2 weeks after photo when Sonia came back in. And anything you want to add to this, Kate, as well?
honestly, it sometimes this stuff blows me away when you're getting into these treatments, but you can see her redness is already starting to subside. We have more work to do. This is just one treatment. Always remember that. You can already see the lines around her eyes of crow's feet have plumped up. You can see her pores look better. And just general, the brightness and softness in her skin already after one treatment. We spoke to her, she's thrilled, so I'm thrilled too. I can't wait to do the next one and see what that looks like for her.
And the big thing, look at those cheeks, the broken capillaries. Like for
I
somebody who
know.
does have broken capillaries, we know there aren't a lot of things that help with it aside from laser. So to see such significant results, and she looks brighter. You said it at the beginning when we met Sonia. One of the things was she felt dull. She was feeling a little like lackluster in her life and wanted that sort of rejuvenation, and you can see it here. She's definitely glowing, and being able to reduce some of that redness and really helping even that skin tone. I think these are incredible results. Like I said, after one treatment, one session, that's the beauty of combined therapies, right? Stacking those hand pieces allow you to get like really incredible results. And as you mentioned, this society, people don't want as much downtime and they
Yeah,
want results faster, which is what we were able to achieve with this. So that's really
yeah,
great. We do have
yeah.
some questions I want to go through before we go into listening to Sonia's experience herself.
Sure.
But we did have a question. What are some of the common side effects you would expect after this treatment, and what are some of the contraindications?
Well, that's a really great question. As far as contraindications, we want to be aware of medications. We want to be aware of certain medical background issues. We have a full list of contraindications where we can refer to on the SharpLight website, but basically we're worried about anything where the client has issues with healing, any sort of issues with photosensitive medication, heat sensitive medications or conditions. And as far as the side effects are concerned, although temporary and transitioning, they typically are, the pigmentation sometimes will get darker. We are worried about bruising and swelling and redness in general. Those are some side effects. Bruising is like I said, when we saw these on Sonia as well, we saw the pigmentation darken. She's going to have peeling, and the like I said, the bruises and the darkening, the pigmentation. It doesn't last for very long. It's usually just because the skin is shedding, and that pigment will be on the skin for some time. But it always heals. Our skin will always heal, and there are things that we can do post treatment if any sort of scarring or anything happens. But we follow parameters. We follow SharpLight's guide in our training, and typically, if those are followed, we don't typically have any sort of issues outside of the realm of normal side effects.
Absolutely. Yeah, we're something like when working on a vessel, there's two outcomes. You might see a full disappearance immediately, or you may see darkening with that pigment darkening, that coffee grinding coming forward. And with that fractional, that's where, so you sort of get that rough texture at first. I always say people feel like it feels like an orange peel. We don't want them rubbing their face.
Yeah.
And then they'll see that peeling and flaking happen. Um, but if you're ever wondering, especially with stack treatments, because, you have multiple hand pieces here, go back to your Laser Smart training material. It's within your Laser Smart manual that comes with your device and your hand pieces. All of our contraindications are there as well. So just making sure, looking at your absolute contraindications, one being pregnancy, for example, and then some of those contraindications that might be that if they're on antibiotics, you might need to wait 3 weeks until, since their last dose. So some of them are not absolute, but we need to ensure that we're following all contraindications for every hand piece. So if there's one, for SR versus VP dual, you're going to stick with it for the entire treatment. But generally, we have just a list of contraindications for all laser in the beginning of our chapter of the Laser Smart training. Thanks, Kate. So Stephanie also asked, do you still recommend an antibiotic ointment with pain relief after fractional? I had a few clients with allergic reaction to neosporin, polymyxin, and neomycin. So I've had some bacitracin plus proxamine that still works well so far, and they still get an anesthetic effect. So do you still recommend an antibiotic ointment with pain relief after fractional?
So it really just depends on the client. I don't personally use antibiotic ointment afterwards, especially if there's no reason, if there's no infection present. I will typically stick to things like zinc and stuff to really heal the skin. If I'm running into issues with, a burn or something that we are dealing with, at that point, I will likely redirect. As far as our zone, I mean, I'm a nurse and I can't even prescribe certain antibiotics and things like that. I can't prescribe anything. So if it gets in the realm of infection, always redirect to a physician, so that you have the best medication that you can use, topical or oral. I find that sometimes polysporin does cause a lot of allergic reactions, especially on really sensitive skin types. I even get reactions with polysporin post-treatment. So unless there's an infection, I really don't use an antibiotic post-treatment.
Great. Yeah, we kind of just stick with zinc oxide.
We really do.
Zinc, because then you get that anti-inflammatory plus that SPF protection without
Yes.
having to layer too much. You want the skin to go through that healing phase. That's the
Yeah.
whole point. We're creating a controlled wound. So unless, there's an adverse reaction, some kind of burn or sore or whatnot, just stick to that zinc oxide. That's our recommendation. Thanks, Kate. I know from your nurse background, you kind of understand, that wound healing, and that people think that they need to accelerate it, but the whole idea is the phases of that wound healing, and we're causing that controlled wound. So it's not as long of a healing period, and we see that collagen building back pretty quickly. Christina also asked, can we do a full facial and SR and VQ dual on the same day?
That's a really great question. I love doing combination therapy. The stack protocols is combination therapy in itself, but if you're offering facials, there's absolutely room to do, certain facials prior to. Just keep in mind, you want to avoid products that are overstimulating. You don't want to be using any sort of retinols or, acids prior to these treatments. The skin is going to go through some stuff in the next, hour or so when you're doing the treatment. So, and I would avoid things like steaming or anything like that prior to this treatment, before and after. But you can really do, if you don't have all these hand pieces, you can do a gentle exfoliation if you don't have a Q switch. You can do a great mask afterwards of a skin rejuvenation, and adding like a hyaluronic acid mask, like something like that afterwards, is a really great idea. It just depends on what you're offering and what works well, but watch stimulating ingredients, watch the heat prior to these treatments.
Amazing. We have lots more questions, but we're going to just kind of take you through Sonia's journey and continue asking some of the questions are on our next slides as well. So
Okay.
I'm sure they'll be answered that way, but we'll make sure we answer everything again at the end, but we want to be mindful of the time. So let's take you through Sonia's testimonial next, her client experience. So when you are doing testimonials, important to sort of give them the guide on what to say. So you want to learn about their experience themselves firsthand, what brought them in, so their concerns. We had that up on the screen when you met Sonia, what her primary concerns were. We want her to reiterate that, what brought her in the first place from her point of view, and then her results, like what she felt really stood out. So I'm going to
my experience with Yellow Facial was nothing short of amazing. Didn't quite know what to expect. I was a little bit nervous. It went very well, very smoothly. Everything was explained to him prior to. Immediately after, a little bit of spotting, a little bit of things going on, but I did see an immediate result. My skin was instantly brighter, smoother. I had a clearer complexion. Recovery went very well. I walk by the mirror and it's very obvious to me now. I see a huge difference, a significant difference. My skin feels much smoother to the touch. It just looks amazing in pictures, a much clearer overall complexion. Prior to my advanced facial, I had some broken capillaries, a little bit of uneven skin, minor rosacea, and it seems to have really just cleared up all of it. So
I just love listening to her experience.
Right?
It gets me so excited because she really, I mean, you look at those after photos, she really felt like it made a massive difference for her skin. And even through, those first few days where she dealt with a bit of that swelling and those nerves, but, your interaction with her, your, follow-ups, and then coming in 2 weeks later to see those incredible results. She's a happy client. I
Yeah.
always say we can change lives, with these incredible treatments. And you can see, she even talked about her husband noticing her skin change as well. And you know, that makes me smile when we make somebody smile, right?
Yeah, me too. That was amazing. She was glowing. I was very happy. That's the first time I've seen that. I'm gonna be honest with you. It's so beautiful.
Wonderful. I hope everyone could hear it. We've had a couple technical difficulties today, so hopefully you were able to hear it. You may have to play it back, or we have the closed captioning there as well, just as a backup. So this is going to help answer a couple questions here, but quickly, Kate, if you want to just do a little synopsis of the treatment, what everybody just saw, some of your tips, your pro tips on the treatment as well, and how often and how far in between can you wait to do these treatments?
Absolutely. So, like I said, we started with that carbon peel. We did spot treatments right after. Make sure you're always cleaning the carbon in between, like before your DPC treatments. Remember, the laser is attracted to pigment on the skin, and if the carbon's still there, it can target the carbon. This facial is best for skin types 1 through 5. When you're doing the treatment, always pay attention to the skin, pay attention to the reactions, good and bad, expected, unexpected. Check in with your client. Pain is subjective. If a client is saying, they're in a lot of pain or they're feeling a lot of heat, always stop. The thing about this treatment will only work is if you're paying close attention to the reactions, increasing your joules and values if you're not getting the endpoints that you seek. And we learn that in our training. So if you've been trained by me or somebody from SharpLight, we always talk about clinical endpoints and how important they are. Always isolating with the VP dual, not going over those areas again once you've treated them. When you're doing skin rejuvenation, you're going to avoid those areas where you did the VP dual. Always have full contact. And when you're doing the RBM YAG, make sure that you always have good overlapping, that you're staying perpendicular to the skin without touching. And you can go over the area one time, even twice if the client can tolerate it. I mean, everybody has different levels of tolerating. But if not, spot treatment is a good way to really get into those really heavy areas of concern. With this particular treatment, downtime is usually a couple weeks. By the first week, they're still, they're still red after a few days. The peeling will happen depending on how aggressive your erbium passes were. And really with the erbium, you're going to go over the area one time, spot treatment, or twice. And around, I would say, doing this treatment every 4 to 6 weeks is good. Remember, everybody's downtime will be different. You may have to go wait a little bit longer in between passes, and in between treatments, depending on if they're still having some downtime peeling or darkening of pigmentation and things like that. And then always cooling, always hydrating, always protecting, avoiding any heat after treatment is very, very important. So those are my pro tips.
Awesome. So I've seen a lot of questions asking about what to charge for this incredible treatment. And that takes us right to the end here, because we, of course, want to talk about why offer these stacked treatments? Why look at multiple handpieces and be able to offer these combined therapies? Well, of course, it's going to increase revenue because you can charge more. We're going to see those wow factor transformative results, which are great for your before and afters, for your social media. And again, another little plug for our next webinar, we are going through a deep dive into how to capture the perfect before and after, and some of the programs that we have in offering, credit towards marketing material, or we can also pay up to $3,000 for your transformative before and after. So a great source of revenue outside of, your clientele as well. And of course, it sets your business apart. You're offering these unique treatments and you're customizing your approach for your clients and their concerns. You're able to treat multiple concerns at once. You're able to customize their journey. Maybe the next treatment with Sonia, we're able to now do 2 passes of SR. So you can really build as well. So we just kind of say, if you can, why not? With our multimodality device, that's one of the big benefits with SharpLight. It's sort of like, why SharpLight versus someone else? Well, because we have the ability to offer treatments that can be stackable with one device, which is pretty incredible. So to answer some of those questions on what to charge for your Elite Facial, you can see it highlighted here. This is, again, a tier 2 evaluation. So kind of on average, it may differ a bit, your demographic, your clientele, your area, location of your clinic, but we kind of give you some suggestions here where we're looking at our 4 handpieces in the Elite Facial. It's one of our most advanced treatments. One session itself, we recommend around $825. You're going to do 3 sessions. You are looking at $2,225, and a 6-session series. You're looking at $4,205. So yes, it's a high amount. It's great revenue for you. You can look at programs with your clients where you start off with that first treatment, and then maybe that can go towards the sessions. But you can see, they're getting a value with the combined treatment that's lower than each of the single treatments by itself. So it's not that we just add all of the value of 4 handpiece treatments. We actually, have a reduction. I think it's about 25% that our marketing team has worked and done the research for, competitors and what it would be great for your business to bring people in the door, get that wow factor, get them coming back so that you can be increasing your revenue with these stacked modalities. So really great way. People are willing to pay for this because they want those results. So we really hope that this gets you excited for the possibilities of a multimodality device, adding those handpieces. Kate's given some tips and pro tips on, some of the things you can do if you don't have all the handpieces yet. You can start stacking up. We have our carbon glow peel if you have only your RF and your CC peel. We have an age-defying facial as well, depending on the handpieces. We have a whole slew of stacked modalities, and that's really what we're going to be taking you through with these webinars, these Sharpcast webinars. We're really going to start focusing on stacking these modalities and the different treatment options that are available to you. So I hope that helps answer some of the questions there in the chat box. Please stay tuned for many more webinars that we have coming your way. As I mentioned, the next one, which you'll be able to see promoted at SharpLight Inc. on the Instagram there. Follow us so you can get insights into dates and next webinar topics as well. So thank you so much, Kate, for all of your amazing pro tips, all of your technical insight. I love co-hosting with you. Thank you all that joined today with your amazing questions. If we didn't get to your question live, we will reach out with the answers to your questions. But I think we were able to get a really informative session today with transformative results, kind of everything that we want to bring forward at SharpLight, making sure everybody's feeling successful, because your success is our success. So thank you so much, Caitlin, and everybody for joining today. I hope you all enjoy the rest of your day and hope to see you again at the next one. Bye, Kate.
Bye, Monica. Thank you so much. Thank you, everyone. I hope you enjoyed it, and we will see you next time.
Wonderful.